I can do it without it. There was one situation where I literally was like,
Hello.
I had no idea who I was talking to or where I was. I need to have something to look down to make sure I don't do
It's
that
funny
ever
because
again.
I do that. I almost never use notes anymore. Probably will today. Since
You want to say?
Well, I will.
hello?
There are. Oh, hi, Megan. Good.
Sorry, I don't mean to interrupt.
Oh, no worries. Hey.
How are you? Good, how are you? So sorry about change.
So, Bill, I saw you're going to talk a little bit about the. I see you have Nagash in your presentation. So you're going to talk a little bit about the meeting.
Yeah,
and-
yeah.
Yeah, that's great.
Yeah. So I wasn't
So-
sure. Yeah. So Gladys just said that. I mean, I asked her what she thought.
Yeah.
Just
No, I
talk
think
about what we were
that's
talking
good.
about, our meeting, and the
Yes.
things that came out of from that.
I think that's very helpful. I think that's good. And I know my colleague at the time, Etiana, went for part of it. And
Yeah.
Sandeep went for part of
Right.
it.
Yeah.
Yeah, it's great. Good.
Wireless
So
actually works.
maybe the best case scenario is having a phone call with the two of them. In which case we set them up together. My guess would be they'll do another thing like after Heather left, with temporary folks trying to identify things for say for the next months. It's gonna be.
Yeah, I mean, I
great.
completely defer to you on what you're thinking. I would like to talk somewhat about sort of what we've been doing and, just to have a discussion. What's next for our opportunities to just a basic discussion, but I would like to have one, but to give it to you to figure out who that should be and how we should do it, and if you're willing to help me with that, great.
How long were you in Bangladesh for?
For just over a week. It was something that was convened by the UN University and the German government. Something called the Resilience Academy. Sort of looking at this concept of resilience and what does it mean. And so it was a number of academics and practitioners and policymakers. There were 26 of us, and just sort of looking at how we can produce some scientific papers that would feed into the peer review process to go into the opportunities around 2015. So, yeah, it was a very good meeting. Yeah, yeah.
That's what David Carr and I were talking about, putting something into the journals about that upcoming meeting.
Yeah,
Up environment type work. So.
yeah. So that's exactly what we were preparing for. Yeah.
Hi, Big Gladys. How are you?
Fine, how are you?
Are you leaving tonight? Are you leaving tonight? I am. You are leaving tonight. Oh, catch you there. Sorry. I came in like midnight. I was supposed to meet with no, I was going to All right, well, thanks for welcome. More or less. Too busy? As well as I can explain in the next minute. Yes, they're fine. And for you?
Too much work, but everything else is good.
Anyhow, I ran into Megan Parker. She
Oh,
came to
wow.
my meeting last
Forgot.
night
You had a second one.
in New York.
Oh my God.
It's big.
You know, you should, Arizona is coming up. Actually, Carlos is coming as well in December. Well, it's in North Carolina.
I'm gonna be in Raleigh. I'm gonna be in Raleigh in like 2 weeks.
Yeah, I know Megan just gave me a copy of the program.
The pages of the bibliography.
Wedding.
Is it tomorrow? Okay, yeah. So,
Yeah, no, I'd like to get
so a couple of us are going. Yes, we will be there. So we can.
You got any results coming out of the papers coming out of the project?
Okay, so let's talk about
This
this.
is our last round of data collection this month, actually, for our malaria stuff.
We're always looking for good stuff to cover.
We have a lot of, I don't know if you guys do a mining work, but we have a lot of stuff that will come out on mining.
Thanks, Gabby. I'm gonna hang for about half an hour and then
It is very much related.
Well, if you want to, you have stuff coming out?
We will probably in the next 5 months.
How's everyone with it?
That's kind of our blog. It's different.
It's quite hard now. Harder for the small engines.
It's hard either way.
It is.
Trust me.
How are you?
Fine, thanks.
When did you get here?
Yesterday night.
Where are you based?
Over here, but from Uganda last week. I first went to the
good,
Great
good,
Cape
good.
Summit.
We just
Wyoming.
yes.
Do you want to sit here or do you want to sit here?
Okay, I'll sit in the
You
middle.
sit in the middle.
So Gladys,
Here, we'll switch our.
Gladys, we thought you'd go first.
Okay,
I drank out of
And
this
you're
water
gonna
right now.
talk for, how long are you thinking of talking for?
maybe 15 minutes.
Okay, great.
Maximum 20.
Okay, that sounds good.
And we can use the clicker for the.
Yes. So, Gladys, we start with you, then we go to Trisha and then to Bill.
Yes. Bill has a hard part. Talking out to has to say something that no one else has said, which is hard.
I have to wake everyone up.
It's,
I know, which is
we
very
need
hard,
you to use the microphone because it's being
After we send them off to
webcast.
sleep.
Yeah. So Gladys and Bill, just we'll need you to use the microphone because it is being webcast.
Okay.
So that's Lawrence's cousin, first cousin.
Hi, how are you?
And official photographer.
Yeah.
Yes, for a bit until he has to go. But
Documentary.
he works here. He works in the White House.
Welcome. We'll get started in just a minute. So I see lots of good conversations going on. So give you a minute just to conclude your conversations and we'll get started.
When she was
You should tell David.
You'll be able to use this. Yeah, yeah. So good afternoon. Welcome. My name is Roger Mark D'Souza. I'm the Director of Population, Environmental Change and Security here at the Woodrow Wilson Center. And I'm excited for this discussion today, focusing on gorillas and family planning. And, you know, I always do a reality check with my teenage son. He always wants to know what I'm going to be doing for the day. So as I was taking him to school this morning, he said, gorillas and family planning? Huh? What's up with that? You got to explain that to me, Dad. So, you know, I'm really glad that we have an opportunity to talk about how these issues come together, because this is very much what we do at the Wilson Center. I think that we explore these issues and have an opportunity to talk about what this means, to highlight innovation, and to think about practical applications. And that is really important for us here. As many of you know, we serve as a living memorial to President Wilson, and this is very much what he focused on. And our logo here at the Wilson Center is independent research, open dialogue, and actionable ideas. So I'm looking forward to today's discussion with that in mind. As many of you know, the Environmental Change and Security Program has been around for a while, for about 19 years, and we look at the various connections between health, environment, livelihoods, population, and security. The work is being funded by USAID's Office of Population and Reproductive Health. So we'd like to thank and acknowledge their support in bringing these important issues to the fore. In talking to Gladys, one of our speakers earlier today, it was interesting because Gladys, I think in reflecting on what brought her to the issues that she works on today, had a similar reaction to my son. And Gladys was telling us about when someone from USAID originally approached her about doing work on family planning. And she said to him, I don't want to do family planning. That's really strange. Yet today we have Gladys, who has emerged as a champion, not only for gorillas and other wildlife, but also for family planning. And in fact, one of our colleagues, who's a well-renowned journalist, just described her this morning as a hero of the planet. So we're really delighted to have Gladys with us and to start off the conversation, just because she's a hero of the planet, but also she has managed to pull these issues together in a real and practical way. So as many of you know, and you see from her background, she's the founder and CEO of Conservation Through Public Health, who are celebrating your 10th anniversary. Congratulations. A real accomplishment, and Gladys really has been serving as a champion for the integrated approach on population health and environment, but in her context very often talks about it as One Health, and is looking at the connection of promoting biodiversity conservation by enabling people, wildlife, and livestock to coexist. So very interesting and important connection. So with that introduction, Gladys, I'd like to hand it over to you.
Yes. Well, good afternoon, everyone. I guess that's how we greet people in Uganda. I'm very happy to be here, and thank you very much for the great introduction, Roger. I'm also glad that my husband's not able to be here as a founder of Conservation Through Public Health. He's been here before to the Woodrow Wilson Center, but his cousin is here to represent him, David Zikusoka, who works in the White House, actually, with Joe Biden. And I'm very excited to be able to come here. The 10 years have gone by very quickly in CTPH. Next thing we knew, it had crept up on us that we've been around for 10 years. And of course, you ask yourself, what have we really been able to accomplish in 10 years? Sometimes it looks like you've not really done very much, but other times you realize that you've made a lot of strides. And I'm looking forward to talking about this just now. Okay. Some good news that has happened in the 10 years is that the mountain gorilla population has recently increased from 780 to 880. As you can see in this slide, the mountain gorillas are only found in the Bwindi and Virunga National Park. And they're surrounded by some of the most densely populated parts of the whole part of Africa. I'm mainly going to talk about the Bwindi population, where we started our program. And of course, every time we've been doing so many things with the mountain gorillas, they've received a lot more focus than other national parks in Uganda and Africa as a whole, because they're so critically endangered, with the numbers numbering below 1,000. And so when the recent census showed that the numbers had gone up this much, everybody was very excited. We all felt that we had something to contribute. As I mentioned, the mountain gorilla habitat is very densely populated. This is Bwindi National Park over here. It's really a hard edge, as you can see over here. The moment it became a national park in 1992, they basically told people, you have to stop going into the forest. There's no buffer zone in most of the park. So the gorillas often come out thinking it's part of their home range, which it used to be, and causing a lot of conflict. Over here, I took this photograph from Bwindi, but I'm overlooking to the Virungas, where the other mountain gorillas are found. And as you can see, people live in very remote homes over here, and they're very hard to reach, even with any kind of social service. And we find that within our program, we've got to reach even those remotest communities. PHE has enabled it to happen. I started, as Roger says, family planning was something very strange to me, because I'm a wildlife vet by training. And when I started working in the Uganda Wildlife Authority in 1996, I was their first vet. One of the very first cases we had was scabies, sarcoptic mange in the critically endangered mountain gorillas. This infant died, and the rest only recovered with treatment. And of course, at the time, we all thought what could have caused it. And we suspected people, and later on it was proven that it was people when another outbreak occurred in another group. And you may ask yourself, how did the people get the scabies? And actually, when we had the skin disease in the gorillas, I asked a human doctor friend of mine, what's the most common skin disease in people? Because common things occur commonly. It's what we learned in veterinary school. And she told me scabies is one of the most common diseases because it's a disease of poor hygiene and poverty. And it actually ended up being that. This picture was taken of these children when we were coming out from one of the gorilla groups in the southern sector of the park. So of course, you'd think, how did they get it? They come out of the forest and they go into people's gardens. Sometimes they're looking for banana plants. And unfortunately, they destroy the plant because they like the stem to get moisture. So that makes the farmer even angrier because this is his livelihood. And this particular farmer, I asked him, do you think gorillas are important? And he said, yes, my children are employed by the park and money from gorilla tourism goes to my community. It's now an act of parliament in Uganda that 20% of the park entry fee has to go to the community. And recently, $5 from every gorilla permit goes specifically to the Bwindi community. He said, but the individual farmer like me whose crops are destroyed, I'm not getting compensated. He later on became one of the leaders of the human and gorilla conflict resolution team of people who were trained by Wildlife Authority to chase gorillas back. So a few years later, after doing a zoo medicine residency at North Carolina State University and North Carolina Zoo, we decided to set up CTPH. With some confidence in, I also did some classes at Duke University in nonprofit management. We came and set up CTPH, convinced my husband Lawrence as the first donor, as I mentioned in the tenure, with $100. We opened up a bank account. We decided that the mission, which has kind of changed a little bit, but it's always been about the same thing, promoting conservation by enabling people, wildlife, and livestock to coexist through improving their primary health care and livelihoods in and around protected areas in Africa. We thought of livelihoods as well because many people have poor public health because they're poor. And our vision is for people, wildlife, and livestock to live in balance, health, and harmony with local stewards taking charge of the environment, local communities taking charge of the environment. We have 3 integrated programs: wildlife conservation, of which the main part is wildlife health, community health, and livelihoods. The livelihoods started by accident, kind of, because Lawrence he went to India and worked in telecenters. He's got a degree in telecommunications, helped to set up some telecenters in India. And he said, why don't you bring the idea to Bwindi? Of course, the first thing people said is that, these people just need chalk. They don't need computers. But surprisingly, the youth in the community embraced it. And because Bwindi is a tourism zone, they exchange emails with tourists, and they continue communicating with them long after. This particular photograph I like it because it shows how it's a healthy female. She's called Karunji, which means beautiful, with her baby. And gorillas are very good in family planning. If we were like them, we would be much better off. The interbirth interval is 4 years. Actually, recently I was at a Great Ape Summit. I've just come from there in Jackson Hole, Wyoming, together with the film festival. And one of the gorilla researchers in Bwindi said, the Bwindi gorilla's interbirth interval is typically 5 years, and in Virunga it's 4 years. She's studying why there's a difference. But if it was the same with humans, maybe the world wouldn't be so overpopulated. So I'll talk briefly about the first program, which is the Wildlife Health Program. We work very strongly with the national park authorities, very closely with them. We really want them to take the lead in doing this so that it's sustainable. So we teach them to identify gorillas, especially those which are sick, and also to take samples regularly from the night nests of the gorillas, which make nests every night. And we do other zoonosis investigations, also in another park that we work in. That's anthrax under the microscope. There were hippos that died in Queen Elizabeth National Park, over 100, and they got anthrax. And because we came in 2010, we stopped people eating them who then had died of anthrax when it happened a few years before. And over here is Stephen, another founder member of CTPH, in the gorilla research clinic which we built. The US ambassador came over to Bwindi and managed to look under the microscope as well. It was when we got our first funding from USAID through African Wildlife Foundation to support this work. We also look at the livestock because the livestock are always between the gorillas and the people, and we improve their health. This is a student from University of California, Davis, who managed to raise some money, and we looked at Giardia and Cryptosporidia in people, livestock, and gorillas, and got some very interesting results. So the main program I'm going to talk about is the Human Public Health Program, which actually began when I was still UWA vet. We developed these brochures when I was the vet for Uganda Wildlife Authority, when we held these health education programs. And I did find out at that time that many people could not read and write in English, but they could read and write in the local language. And when we carried out this health education, I told them what the problem was about people and gorillas being closely related, picking diseases from each other, and how gorillas are curious. A baby gorilla will try and touch your camera, will try and touch your clothing, and then can pick up diseases, and it can go through the group. Then I had the solution for them. And then I was just about to tell them, now this is the solution, but the community conservation ranger and district health assistant touched my hand and said, let them tell us what the solution is. And their solution was much better than what I had proposed. So that was a real eye-opener in participatory rural appraisal. And a lot of those recommendations are what we used to start up conservation through public health. And over here, one of the first things we did was strengthening local drama groups, and this was Cheshire Primary School around Bwindi. And then down here is Hope, one of our star community conservation health volunteers, or PHE volunteers, but now we call them village health and conservation teams. She's giving a village health talk to her community, and she's becoming a leader in her community in conservation, where both the men and the women listen to her. One of the very first programs we did was tuberculosis, CBDOTS, where we got funding from the Irish government to look at this issue, because I had been doing research on TB at the Human Wildlife Livestock Interface while at North Carolina, and we found that communities in Bwindi were dying of TB because CBDOTS wasn't strengthened, whereas in Queen Elizabeth, they knew who their volunteer was. So this was one of the first programs we did. Of course, if you get TB in gorillas, it's almost impossible to treat because it's daily treatment for 8 months, and after 2 treatments, the gorillas won't agree. Over here is Vasta. She's one of the first female graduates in the whole of Bwindi area, and she did a bachelor in tourism because of the mountain gorillas. She was one of our first employees. Standing next to her is her late father now, who was a senior traditional healer. And Vasta right now has 4 children. She's just had her 4th child. She's in her late 30s. Now, in her community, by the time you're 25, you've had 5 children. By the time you're 36, you've had 10. But because her father managed to send her to university in Kampala, Makerere, she was able to come back and say, I'm not going to have many children. And she's doing much more with her life. This was information we collected recently in Bwindi and Virunga, and we're asking people number of children they would like to have. Most of them said 6. Actually, most of them have 10 or more. And it's interesting now, we're trying to see how we can address their unmet need. So, as Roger says, how did we get involved in family planning? When I first came here with Dr. Lynn Gaffikin hasn't been able to come. She introduced me to USAID, and the USAID officer at the time, Tom Outlaw, said, we have money for family planning, but we don't have money for zoonosis. And I thought, no, family planning, that's not what we're doing. How can I be distributing condoms to people around the national park? I found that a bit strange. But then later on, when we started the community program, and I saw that people are really poor, they have so many children, then USAID came back to us and said, can we add family planning onto the CBDOTS model, which was working very well. Then we got into family planning. The first thing we found out is that the flip charts that the health sector has, we don't really have them in conservation. The good family, the bad family. So we designed this with Mango Tree Enterprises, where, this is a family with many children, and then only half of them are going to school and half of them are to chase wildlife in the garden. That was one of the things that came up in the survey. I have 10 children, half go to school, half chase wildlife back to the garden, away from my garden. And then eventually they get teenage pregnancies, some of them die, and it's a bad situation. Whereas with the good family, they happen to have 4 children, happens to be 2 boys and 2 girls. And when the gorillas come out, they call out the Hugo, Human Gorilla Conflict Team, they chase them back. Eventually, the son becomes a ranger, the daughter becomes a nurse, and you tell them, which family would you rather be? So the village health and conservation teams are the people who go out to the village. There's 1 or 2 per village. We're building on the community-based healthcare structure that the government of Uganda now has internalized as the village health teams. And they go out and educate their community about family planning issues. Over here, one important part that we did is we got in touch with Family Health International. And actually, Lynn Gaffikin told us that they're doing CBDOTS. Why don't you become part of their, talk to them and see if you could bring it here. Because when we started the family planning outreach, most people said they preferred the injection. Why? Because they can go on market day and get the injection, and their husbands won't know that they're on family planning. But from the beginning, we told them you have to communicate with your husband, because their husbands would beat them up if they're not having children every day, every year. So we're like, no, you have to talk to your husband. And we found out that we needed to then get the depot program going. And with Family Health International, we managed to get this going, and I think we were like your 4th pilot program in Bwindi. And it really took shape because the number of family planning users doubled and tripled because of depot. This is a typical family. Children are just 1 year apart. Then we got also into other integrated conservation and public health issues like water conservation. These are gorillas crossing the microhydel unit inside the park. This same unit is shared by, the same water flow is shared by the cows, by the goats, by the people. And it's very important that there's water quality for all. So we have here Joseph, our former community health coordinator. He's actually now doing a PhD in America. He was talking to his community about water safety and access to safe water, which was one of the recommendations that communities brought up in 2000 when I was still UAVET. And we did find that we're trying to improve so that they have clean water storage containers, hand washing facilities outside the pit latrine and things like that. We went ahead in the Virunga National Park to implement the same program. US Fish and Wildlife Service supported our work in Virunga, together with Whitley Fund for Nature and MacArthur Foundation. And particularly, the family planning there is even more needed. They have even bigger families, they're even poorer, and they have very few access to family planning resources. In fact, they have to buy them. They're not yet free in DRC. And also, we looked at the hygiene and sanitation there. That's a non-protected water source in northern DRC. But one thing that always comes up with these programs is how do you sustain them? And this happened kind of by accident. The volunteers said to us, after 3 years of implementing the program, could you give us goats and could you give us cows? And we're like, why would you like them? They said, we want to sustain ourselves. So we did. We gave them group goats and group cows. And they went ahead and developed their own income-generating projects. We also gave them bicycles, which they were very grateful for, and cupboards to keep the drugs. And later on, in 2011, CARE started village saving and loan associations around Bwindi. They've been doing it all around the world, working through Bwindi and Mugahinga Conservation Trust. And our volunteers happened to meet the BMCT team and reinvested these into village saving and loan associations. So now they're doubling their income and they're very happy and they're continuing the work even when we're in between donor funding. So some of the results, we now work with about 120 VHCT volunteers. The ones in Bwindi, Kanungu district, we work with often. The ones in Virunga and Kisoro depends on funding, and we want to make it sustainable. They're reaching as many as 44,000 people. And I've put them in different colors because when you go to conservation donors, they say, is your work having an impact on conservation? When you go to public health donors, they ask you the same question. So we really find that we really have to follow those indicators. And sometimes you do find that the family planning indicators, the conservation community doesn't understand. We've had increased reporting of human and gorilla interactions because they also help. Whenever gorillas go into someone's home, they visit these homes regularly, they report it, and Wildlife Authority will send more people to chase them back and increase monitoring at the human-gorilla livestock interface. We've looked at parasites, giardia, salmonella, also during the gorilla censuses. So impact we've had over 12-fold increase in new family planning users, and in Mukona and Bujengo where we work, over 60% of women are on family planning now. which is much above the national average. But when you tell a conservation donor, they're like, so what's new family planning users? Has the family size decreased? They're like, it's hard to measure it in a few years. So I think now we're trying to tell them, okay, it's the interbirth interval has increased. But you find that they don't understand it when you tell them there's new family planning users. They understand that family planning is important to reduce pressure on the forest, but they don't understand that word, new family planning users. Had a 50% increase in hand washing facilities, cleansing material, clean water storage containers and drying racks, and an 11-fold increase in TB suspects referred. We've had reduced human and gorilla conflict, reduced disease incidences in the gorillas, and improved perceived conservation attitudes, which now we want to measure more accurately. So in a way, we've now got a sustainable and scalable model, and over the next 10 years, we want to see how to scale it, either by us doing it, training others to do it. Budongo Forest, they would like us to work where there are chimpanzees, and different parts of Uganda, Mount Elgon, where there's many landslides, and they have too many people. They have 600 households per square kilometer, and frequent landslides up the mountain, and Queen Elizabeth, which has fishing villages which are overcrowded. PHE advocacy is an area where I've started to work with Population Reference Bureau. And in this particular program, we're working with both public health NGOs, like FHI, and conservation NGOs to how to push this forward, to influence policy and decision makers, that it's important to do things in an integrated manner. As far as at every level, you can have integrated district work plans, you can have integrated policies, and we're pushing it in working with the health conservation community, and now more increasingly the livelihood community. So we have all these groups. IUCN is also a part of it, and this fact sheet was developed with support from Population Reference Bureau. We're here today. And one of the areas where the VHCT model, Village Health and Conservation Team model, has been scaled up in the Lake Victoria Basin through a partnership with many people here, including PRB, Balanced, ExpandNet, Linda's here from Balanced, and led by Pathfinder International. ECHO works on the ground with these communities, and Oceanella in Kenya. And our role on this project has been to promote advocacy for these integrated approaches and to take this model to the Lake Victoria Basin. The issues are different. Well, the deforestation is common in all places. They also have a problem of overfishing. So as we scale up this approach to other protected areas and we advocate, we're finding that it's important to get more and more influential champions. There's also the Poverty and Conservation Learning Group, which is really interested in our work. And recently they brought out some findings. You may have seen them in the media, and where they did a study to see what makes people go into the forest to take illegal resources. Is it just poverty which is driving it? And what's interesting is that in Bwindi, the biggest thing is bushmeat. People go in to hunt, and it's not the poorest people who hunt. It's the people who've been doing it for generations. For example, we had a gorilla which was poached in 2011. It was killed, not poached, and it got into a fight with a hunter's dog. That hunter had ever received a goat from Uganda Wildlife Authority, but he didn't think about it when he speared and killed the gorilla. My team from CTPH did the postmortem, and they followed the track of the dogs right up to his house. So it was really him. He managed to bribe the magistrate. He only paid $20. And you ask yourself, why did this happen? And I think the way conservation community does development work doesn't work. You don't just give someone an individual goat. It should be more of a group project. Another interesting finding that came out is that the second most important reason for going to the forest is to collect medicinal plants because people are not feeling well. So everyone feels that we should spread the VHCT approach all around so that people have less need to go into the forest to collect medicinal plants. The CTPH patron is Her Royal Highness Queen Sylvia of Buganda, which is the biggest kingdom in Uganda, and she's a great advocate for family planning. She works closely with PSI, and she works closely with all the public health groups, even with the UN Women. They support her work a lot. And she is now got interested in conservation as well, being our patron. She was the first queen in the world to track the mountain gorillas. This happened in 2005 when she came to launch our projects there. And recently, when we had our 10-year celebration, she opened a cane rat exhibit in the zoo because the cane rat is her totem. And in our culture in Africa, you're not allowed to kill or eat your totem. My totem is the lion, so I'm not allowed to kill it. So we're trying to see how she can become an advocate for PHE. She's very influential in Uganda. And then I recently joined the UA board. I'm actually one of the first board members, the first board member from UA to join from the civil society sector. And so all the NGOs, it's in the conservation NGOs, are always coming to me with all the issues they have with UA. But they see me as someone who can help to bridge the gap, which I'm trying very hard to. But it also means that UA is more willing to listen when I talk about the importance of family planning around the protected area. And they really want it because they have so much pressure to degazette the park. The president is always, they always get, phone calls from State House. This person wants to go into the community, especially like Mount Elgon National Park. Whenever there's a selection time, people tell the president, degazette it. Because they see that it's free land and they have so many people. They have early pregnancies because they want land. And it's just a disaster. But so UA really, really wants family planning around the national parks. We also work with NEMA in the Population Health and Environment Working Group. They're very strong. We work with Population Secretariat, is actually chairing it, and they really are happy that they have more people on board. Then some of the next steps we want to do is to work with training institutions like Duke University, and I'm glad that Bill Pan is here today. And we want to develop a PHE curriculum. We've had a lot of people who are interested in the work. Actually, PHE and One Health. We've hosted a few vet students, a few medical students, public health, conservation students, studying a few things. Our most recent student we hosted has been studying the role of women in conservation. And the reason why is because when Bill and his team invited me over to Duke in February, she got to understand how it makes sense. Women get involved in conservation when you're doing PHE. So she managed to interview a number of people, some of whom we work with, some of whom we don't, and she's coming up with some very interesting results. We want to build a community health and gorilla conservation center, and we hope that this name can attract donors from the public health and the conservation community, because when you give it a certain name, the public health community is like, no, but that's just a research project. And so we have to show that it's really needed, which it is. And we want to basically use it as a permanent home to do all this work that I'm talking about, and also be a study site for people to study how this approach works. Get involved, sign up for a monthly new newsletter, visit us. There's a tour company that wants to bring tourists to us, and they can host them there and then bring them to us. Make a donation through our website. And we want to continue to support village health and conservation team meetings and outreach as they become more and more sustainable. We want to support this center, and we want to scale up to other protected areas. And participate in special events. Today is one of them. We're celebrating 10 years of CTPH. Thank you all for coming. And I also want to recognize Alan Weisman. He came over to Bwindi, and he's just written a book, which is being launched today. And I think he said we're also in the book. And also Ken Weiss, who came over from LA Times. He's no longer in LA Times, but he featured us in the Beyond 7 Billion series. Thank you very much.
Thank you very much, Gladys, and congratulations again. So there are three things that you said that really stood out for me. And the first was about just sort of looking at the interactions and lessons learned. Of course, starting with your statement that gorillas are good in family planning, and if we would like them, we would be better off. But also talking about the tools. You talked a lot about the tools that you learned, the flip charts, the use of Hugo's, which was very good, and lessons that you learned in terms of sustaining efforts. So that was very helpful. The second point that you raised for me that I thought was fairly important, you talked about communities. And the community approach, and you said, you learned that their solution was much better than what you had proposed, but then you also spoke about going beyond offering an individual goat, that it is very much a group project, so recognizing the importance in Gladys's work of this community approach as a point of entry that really allowed her to bring these different communities together and build sustained efforts. And then finally, I really liked about how you talked about building champions, starting with your husband, who was the first donor, very important, to the Queen, who is emerging as a champion. So how to go from your husband to the Queen, but also talking about the range of donors and indicators and reporting and targeting that reporting and recognizing that there are different ways that you need to tailor that in order to be successful and sustain these efforts. So a very comprehensive view, and congratulations and thank you.
Thank you very much.
So we'd like to move on to our second speaker now, Trisha Petroni, who is a Senior Technical Officer for Global Health, Population and Nutrition at FHI 360. And when we were talking about the order of our presentations today, Trisha said, I want to go after Gladys because I want people to really understand what her work is about, because I want to comment and build on that. And I think that's really important because in Trisha's work, she's looking really at how we can use evidence within global development to support policy and programmatic decision making. And I'm quite pleased to know that her work focuses on how do you develop linkages between family planning and other key programs within health, but also in non-health sector settings like environmental conservation, microfinance, and agriculture. So Trisha, with that introduction, I'll hand it over to you.
I might scoot over a little bit just to make sure that everyone can see.
Can you hear okay?
Okay, and thanks. And as Roger Mark said, I did suggest that I go after Gladys, but that makes it hard because she's interesting, and then that sets the bar high to be as interesting. I am excited to be here for a couple of reasons. One is that it's always really nice for any opportunity where I get to see Gladys in person. I think we've spent a lot of time working together, and it's always virtually, and it's nice when we get to actually cross paths. But another reason is that being based at FHI 360's headquarters in North Carolina, unbeknownst to Roger Mark or others, I'm often watching these webcasts, alone in my office, being very interested and, really wishing I was in the room so I could ask questions and things. So for me, it's actually quite cool to be here and to get to see some of you that I usually only see virtually. So I am going to give us a snapshot of the partnership that CTPH and Gladys had with FHI 360. And to do that, I'm going to say a little bit about what we did, but then maybe even more about what we hope that other people might be able to learn from our project. I chose the somewhat cliche title of this presentation because I think that you'll see through our experience that advancing integrated population health and environment work actually does take commitment from a broad range of stakeholders. So just to start with the big picture, and I know that this is probably representative of something that everyone in this room already knows and knows really well, but I think it's a critical starting point for the discussion. It's why Gladys and I know each other. It's why our partnership ever even happened. I think that PHE has an enormous potential to simultaneously improve health and environmental sustainability, and I think that's why over the years people have realized that maybe linking key health and environment programs in certain settings might actually be greater than working in the vertical silos of the past. But I think that importantly, the potential benefits of an integrated approach are not inevitable. So effective implementation of such a multi-sectoral program requires some really important adjustments to the single sector models of the past. And I think that this is the somewhat less obvious part of the PHE equation. So a broader mandate naturally requires any organization to expand several core technical and functional capacities. So I, am very aware and openly acknowledge that PHE as an umbrella is a lot bigger than family planning specifically into an environment program, but today I'm going to focus mostly on that in my example because that's what our partnership
was really about. So using that as an example, again, a broader PHE mandate means that a historically environmentally oriented organization means that their staff have to become familiar with a whole new universe of things around family planning, maybe seemingly endless universe to some people. It's policies and regulations and guidelines and best practices and evidence and indicators and tools and materials and all of these things that come along with a brand new technical area. So no matter how strong the rationale might be for PHE or even the commitment of a passionate program to it, I don't think that these are minor details. As the popularity of PHE grows, I think we've also started to realize that there's a lot of capacity needs related to that, and some potential solutions, one strategy being partnerships like ours between environmental and reproductive health organizations. Which, of course, is how the two of us got here. Like many organizations attempting to link multiple programs under a single programmatic umbrella, with the PHE model, CTPH started experiencing some new challenges with deploying effective M&E of the PHE approach, as well as advocating for it regionally and globally. So in 2010, with support from USAID under the FHI 360 Progress Project, we established a 2-year capacity building partnership. And that was really meant to strengthen CTPH's capacity in doing high quality monitoring and evaluation of the PHE component of their work, as well as doing advocacy. So first of all, why in the world would it be so hard to track the addition of family planning onto your program? I think anybody in the room or watching, working in family planning, could give you a whole host of reasons. Monitoring and evaluating family planning, even in standalone programs, is a full-time job for hundreds of people around the world. It's not necessarily an easy, straightforward thing to do. There's a lot of workshops and training materials and guidebooks providing recommendations for how to effectively do this. So I think, first of all, it can be quite complicated, but if doing M&E for a typical family planning program is hard, I think doing so for an integrated family planning program can present its own unique challenges. So in this case, thinking about what Gladys told us about their program, consider what they're actually trying to track, right? So for a fairly small organization, they have a lot of program facets. So they have the wildlife component, things like tracking anthrax outbreaks, and then they have a human health component. And even within human health, things are so diverse. So strategies for improving hand washing and sanitation are really quite different from what counseling for family planning and providing services looks like. So not only is the sort of activity spectrum quite broad of the work that they're doing that they need to monitor and evaluate, as a small organization, they're asked for an enormous volume of information from a lot of different stakeholders. So you have the National Wildlife Authority that wants to know certain things. You have the Ministry of Health for the family planning part. They want to know certain things. As a nonprofit, they have a host of funders, and they have their own separate sort of information demands. So anyone in the room think that those are sort of coordinated and streamlined for Gladys and her organization in a way that makes sense? No, exactly. So even, as FHI 360, we actually have quite a deep expertise in monitoring and evaluating family planning and doing advocacy. But I think in this instance, we realized that for a short period of time, bringing someone on with some real fluency in PHE M&E was going to help us sort of sort it all out, and she was great. So I think after getting some guidance, we worked together to produce an updated M&E system for Gladys's organization that had a refined and expanded logic model, a new series of indicators, some different data collection forms, and a comprehensive database. And because it was a capacity building project and not strict technical assistance, we really did work very closely together. I think, FHI could have come in and maybe finished it in 3 to 6 months if we just did it for them, but we actually worked together, which is why it maybe took the full 2 years. But I think that approach was really important, and I wouldn't say that it's, a case closed and done, but I think that this effort really did strengthen their entire monitoring and evaluation system. So just to switch gears to the other half of our capacity building partnership focus, which was advocacy. I think anybody who has known Gladys for more than 5 minutes might be really confused and surprised by this part of our work. Why in the world would we need to work with her on advocacy? She's a super advocate. She's dynamic and charismatic and can articulate, the value added of PHE better than most people I know. So again, why would we work together? I think, to start, part of it is because she can churn out ideas for advocacy like nobody else. We together thought it might be a good idea to sort of harness some of those ideas and that passion into a couple of focused, feasible, and really systematic strategies, narrowing in on select things that CTPH really wanted to achieve. What did they really want to see change, say, over the course of a year? We figured that out and then worked backwards with a plan toward that. And I think in this case, the second reason we did it and why we wanted to have a plan is that CTPH is an organization. It's not Gladys. So she's a super advocate, but she has a lot of staff who needed to be involved in this effort. And I think having a plan provided something concrete and tangible to guide staff overall. So there are a couple of nice bits about the plan. It helped CTPH steer and inform a similar type of advocacy plan developed for the Uganda PHE working group with some other partners and with some nice support from Population Reference Bureau. Another nice thing I thought was some peer advocacy, where they brought some of the members from the PHE working group out on a study tour to some of their sites, so to really exchange knowledge and catalyze similar PHE models to be replicated in other programs and settings. So, I could probably talk about our 2-year partnership for a really long time and get bogged down in the details, and I don't want to do that. I think providing you just with a little bit of background is a good sort of starting point for sharing with you what we have collectively come up with as our lessons learned. One of the major takeaways for me throughout this process was just how significant the leap is between knowing about PHE, really believing in its potential, being committed to the approach and understanding its potential benefits. So the leap between that and, on the ground, in the real world, delivering effective, high quality, ideally evidence-based and impactful programming. So I don't think that funders or practitioners should underestimate the sort of learning curve that comes along when you have this new multi-sectoral approach to your work. So when you have an organization that's historically, had really great successes in one sector and which is staffed by experts in that sector, takes on another line of work. That learning curve can be really huge, and I think that we all just need to be more transparent about that as a challenge. But I think both Gladys and I would be willing to say, I think one way to address that challenge is through partnerships, cross-sector partnerships, to sort of leverage the comparative advantages that each one can bring to the table and hopefully do more impactful work. So I think I just wanted to close with a couple of recommendations based on our experience. I think the first one is fairly clear-cut, but I think as funders continue to sort of really engage with this idea of doing integrated programming, they should be realistic and allow and perhaps even encourage these types of cross-sector partnerships as a foundation for any new PHE program. And that's not to imply that this isn't being done. Obviously, we did it, and I know of several other instances where there's some nice partnerships, but I just wanted to underscore, I think, the importance of having donor buy-in for this strategy and to hopefully see it institutionalized really as standard practice as this field continues to evolve. And the next point is that I don't necessarily think that the global family planning community is deeply engaged enough in the PHE field to date. And that perhaps serving as, a capacity building partner on high quality family planning to organizations like Gladys's is a really nice entry point for us to start doing more in this area. And I'm not necessarily talking about the sort of more advocacy-oriented groups like PAI. They've been out there doing this for a long time and doing a great job. I'm really talking about the direct implementers, the people on the ground doing family planning service delivery. Being from the family planning side myself, I was telling some folks the other day, you know, I sit in a lot of rooms where people are pulling their hair out in family planning, trying to figure out how to reach these really remote populations and vulnerable groups with family planning services, and they're either entirely not aware of the interest from the environment sector who do work in those areas in folding some of this in, or they don't take that option seriously enough. And I think that that's a really unfortunate disconnect. So I think, you know, the family planning folks out there who might be listening or watching, who feel like, you know, we've stalled a bit in making family planning progress, should reach out to some of the fantastic environmental groups who are right now driving the PHE agenda and doing really great work, because I don't think that we should keep missing out on this opportunity. And vice versa, that goes both ways. I think programs doing conservation and environment work who are interested in adding a family planning component to their work, they don't need to do this in isolation. There's a lot of existing family planning networks, you know, in virtually every country. So I think it's worthwhile to do a scan and to do some real outreach and to see how collaborations might work so that, you know, you don't have to go it alone as an environmental organization trying to do a brand new thing. And finally, you know, I sit on a team at FHI 360 called Research Utilization. So even though this presentation was about partnership, I can't help but mention the general need that I think is acknowledged from lots of people for more evidence in the PHE field. But my sort of point to underline in that is that it's not just evidence needed about what the ultimate impact and outcomes of this work are, which we do desperately need. We need more rigorous research on how on what these programs are producing, but I also think that the partnership aspect within operationalization is really important, and we should be taking, like from global health, the implementation science angle and really looking at how these programs are delivered to get to those outcomes, and I think that's important as well. So this smiling gorilla says thank you to everyone for being here and listening. And then I would be very remiss if I didn't mention my colleagues from FHI 360 who worked with myself and Gladys. I by no means did this on my own on our end. So Orly, Bwindi, Angela, Cole, and Patricia Wamala did fantastic work, and I wanted to just say thanks. So thanks.
That's great.
Thank you very much, Trisha. I think it's the first time I've seen a smiling gorilla.
Google Images. It's amazing.
I guess a few things that you said that really appealed to me was this reminder that this is really an emerging field. You know, if we compare this integrated field of population health and environment to other more well-established areas such as public health, we are really still very much an emerging field. And your comments were very much about being honest, being transparent. I was struck by how often you said those words and thinking about what does this mean for the operationalization of this work and recognizing that. I liked very much that you talked about the leap. You know, you said, and I was quite struck. I'm not sure that I've heard as many people say this as clearly as you have. You said the potential benefits are not inevitable. Adjustments must be made to the single sector partnerships. So that I thought was a very important and very compelling message. And then your point about how wonderful it is to have a Gladys here and present in the field, and that she's a super advocate, but this is much more than just Gladys. It is much more very much looking at the team and harnessing the ideas and passion and focusing that into feasible efforts where they want to see results. And just reminding us that ultimately, both the humans and wildlife will thank us. So thank you. Let's move on to our final speaker, Bill Pan, who is currently an assistant professor of global environmental health at Duke University and serves on a steering committee for the National Carolina One Health Collaborative, which I think also fits into some of Gladys's work. Bill's work focuses on the interface between human activities and the environment, and he teaches courses on population health and environment and in spatial epidemiology and demography at Duke. So Bill, I'll hand it over to you.
Thank you all for coming. Thanks for the organizers for inviting me, and thanks for Gladys for starting 10 years ago, CTPH, so I could come and can talk to you guys. So it's hard to follow up both Gladys and Tricia and be the third speaker on this panel, especially since I don't actually collaborate actively with Gladys. And so I first thought, what am I going to be talking about? And then I received all these emails from people similar to what Roger Mark was saying is, well, what the heck do you know about gorillas and family planning? And I said, absolutely nothing, except for gorillas are probably good compliant users of contraceptives. So my comments, I talked to Gladys, and I was an organizer for the PHE conference in Duke, along with a couple of my colleagues at Duke University. And so I'm coming to you today really to talk to you about some of the messages that came out of that conference. But to set up that messaging, I really wanted to take a step back and look at some of the history of PHE and how it evolved, and how things that have already been said are still being said today. And we really haven't solved a lot of the issues that have been stated even 200 years ago. So if you're a population and health environment person, a demographer, or deal with health, everyone knows about Thomas Malthus. He's the father of demography. He's probably the father of PHE as well. Everyone knows the story about how human population grows geometrically, resource use and extraction, agricultural development tends to grow arithmetically. So eventually we'll hit this point of a tipping point of massive famine, poverty, and death. And this is outlined in his essay of population back in 1798. The thing that is often forgotten in some of the things he talks about are these preventive checks and the positive checks. The positive checks, which isn't necessarily a positive, are things that increase death rates. This is the feedback you get from the environment onto people. But the preventive checks, he outlined very intuitively that ways that we have to reduce the birth rate is family planning, reducing, delaying marriage, exactly what, kind of the same thing as expanding the number of years between births, abstinence, birth control. He also mentioned the fear of famine and homosexuality, which was probably at that time, there was more of a church influence. So, but the fear of famine is actually very important because he laid out an argument saying that if a famine did hit a community, that fear of a famine actually might delay childbirth. But actually saying that birth control is an important part of population control was something very intuitive that hadn't been really described yet. So if you move forward 200 years, back in the 70s, you have a lot of debates going on in literature, and there was a lot that was written about how population, environment, and development are related. And Paul Ehrlich and John Holmgren wrote a paper in Science trying to dispel some of the things that were being written about saying that population didn't matter and population growth is not that important in terms of environmental degradation. And so they kind of laid this out in terms of 5 theorems, and I'm going to go over them relatively quickly. The first one is really just this idea that population disproportionately affects the environment. So here they're talking about the law of diminishing returns, the IPAT equation, which I'm sure people are familiar with, where you've got human activity having some kind of impact on the environment, and it's measured through this equation of IPAT, and also this idea of threshold effects, where as you're drawing resources from the environment, like a fishery or logging, you could hit a tipping point where you draw too many resources and all of a sudden those resources will collapse. And the environment is nonlinear. And so even if people are talking about population growing at 50% rates, but our resources uses are going up 500%, and there's a disconnect here, that the point is that there's a law of diminishing returns and there's thresholds that you have to take into account. The second thing, which is really a centerpiece of what Tricia was just talking about and what Gladys works on, is this idea that population growth and size, resource use and depletion, and environmental degradation, they have to be considered jointly and they have to be considered globally. Jointly is this idea of PHE. Globally is this idea that what happens here and what we do here affects people somewhere else. We do this in our research in Latin America. So most of my research is in Latin America, and we deal with this idea of livelihood choices affecting people that are far away because of mercury transport or land use change or something like that. And he actually says in his paper, his quote is that the investigation of synergistic effects is one of the most neglected areas of environmental research. And so it's something that that he mentioned 30 years ago, and it's still true today. This idea that population density is a poor measure of population pressure. So what he's really getting at here, I shouldn't say he, I should say they, is that they're really talking about this idea that population density, because there was a lot of arguments that you have high population density, but it's not really causing environmental impact. But the problems with population density are actually about resource distribution and how you have resources and you're distributing them across a population. So it doesn't matter if you have a highly dense population or a moderately dense population, you still have to distribute resources equitably. And that distribution becomes harder and harder as you get more and more people. So in other words, resource distribution is a function of population size. This idea that environment, it goes beyond just the forest and the trees. I actually had a meeting with a collaborator this morning from ACA, which is the Amazon Conservation Association, and they're getting threats right now from mining groups to burn down their biological station because they're putting out information about environment and the impact of mining. This is very common. I heard this on the radio in North Carolina last week about how tree huggers are against certain progress in energy development. But that concept of environment is wrong. We have to make people realize that environment means human social systems, urban environments, and there's an epidemiological environment. And the last thing that they really talked about, their last theorem, was that theoretical and technical solutions are not always operational. You have scale difficulties, you have funding difficulties, and they're sometimes not even the solution when you scale them up. It doesn't work. They're not saying that technology should not be used. One of the things that they try to make clear is that technology is very important, but when you try to implement a new technology or a new idea into a community, you have to think that that implementation also will have an environmental impact, and you have to weigh that environmental impact against what's already being done. And sometimes, even if you have direct environmental impacts that you're measuring, a lot of times you might have technology that's just shifting the burden of the environmental impact onto someone else. And so you have to be aware of shifts and comparing different things. All right, so let's move ahead 30 years. January 2004, Barbara Entwistle, who's now provost at UNC, and Paul Stern got to a panel together to talk about population environment research challenges and insights of doing research and PHE. They were doing PE, but PHE in the field. And the insights that they had are very relevant and directly relevant to the things that PHE does. So let me just go over these recommended directions that they had because they're very important for the things that we do. The first thing was that research should be coordinated to create an integrated body of knowledge. What does that mean? So basically, monitoring and evaluation, when you collect data, we need to have minimum standards for how data are collected, how we define variables that we're collecting, and so that when you're looking across sites, if you're collecting it, whether or not if it's in Africa or Latin America, you can collect a similar variable and hopefully it will mean the same thing. And if it doesn't mean the same thing, you're gonna be able to figure out why it doesn't mean the same thing. And this goes on, they talk about contextual variables. Contextual variables are very important, but they're also extremely hard to measure. And so we should make sure that when we do field projects or research, carefully cataloging how contextual variables are recorded and reporting that information in reports and publications. Secondly, any organization that works with PHE or PE should be thinking about linked data sets. This is a huge challenge in the work that I do in Peru. We collect data on mosquitoes, animals, fish, soil, water, humans, movements, and reproductive health, and land use. How do you get those into a database? How do you actually start even analyzing that information? It's a challenge, and all I can say it's a challenge, and there's very limited research and resources to actually deal with that problem. We need to continue unpacking complex PHE relationships. It's complex. When we have synergies that we know that we should be able to gain added advantage from a synergistic relationship, there's nuances in that relationship that might vary by context. And we need to continually unpack those complexities so we can better understand how to explain how things are related. We have to continue to explore something called scale dependencies. And scale dependencies are not just space and time, but it could also be social dependencies. They also recommend using mathematical models, and I think there are people involved at FHI doing mathematical modeling on some of the scale dependencies and feedbacks. And the last thing that they really push forward is this idea of creating an interdisciplinary research environment. And it was stressed very much, and I see this a lot from Barbara, as well as other people from UNC who were on this panel, that they have a lot of dedication for trying to build and train the next generation of PHE researchers. Because a lot of times people who do PHE research in an academic environment, at least, traditionally you are in silos. And so if you are doing interdisciplinary research, it tends to be more difficult to survive. And so we need to create environments that recognize that interdisciplinary work is important. All right, so let's move to this past year. So this past year, we had a group of faculty supported by the Africa Initiatives at Duke. It's part of the Provost Office, to bring together African researchers to talk about PHE being conducted in Africa. So we titled the conference PHE in Africa, Coordinating Strategies, a week of conversation at Duke University. So Gladys, she gratefully came. We also had a man named Wilfred Malai came, and we had a colleague of mine from Brazil, Alison Barbieri, who came to give us a perspective from Latin America. And the objective of the entire week, and granted, a week was actually a very long time to be meeting. Our objective was really to explore PHE as an advocacy movement, a development strategy, and an academic field. And then we were really trying to figure out, number one, if we wanted to create a PHE academic field, what would it look like and what does it take for a university to do that? Number two, what role does PHE play in guiding funding strategies for donors and aid agencies? And then number three, where are the intersections that are most fruitful between academics, researchers, and implementers in the field, where we can improve our ability to actually create promising interventions? We had very limited funding, but we actually had more than 30 people attend, which was pretty impressive. We had 17 faculty from over 8 universities, 12 people from 10 different NGOs, and we had people from Ethiopia, Uganda, Tanzania, Brazil come to the conference, which was great because we had a nice dialogue throughout the week. The way it was set up is very similar to a conference, but it was small groups where we would have fairly in-depth discussions combined with larger seminars. I'm sorry, this is a very poor quality picture of one of our seminars. So what were some of the things that came out of the conference? There were a lot. I'll just tell you a couple. So the first one, the P in PHE, it needs to go beyond reproductive health. P is not just births. It also includes migration, household composition, household dynamics. And in the same vein, H is not just reproductive health. H for health also stands for a lot of other things, which I think Gladys has already extended into in some of the work that she does. The human livelihoods approach has been used in a lot of PHE research, and it's proven to be a very effective way to approach PHE research. And it's something that I think is going to stick around for a very long time. Communication. People had a lot of difficulty with the way PHE research and policy is communicated, not just in journals, but also in things like newspapers, where sometimes you talk to journalists and things get very simplified because it's very difficult to explain PHE in a newspaper to a population that who may or may not understand the environment or the population or the health aspects of what's going on. So that's a tough one. Communication is also very important to have integration across sectors. The two biggest things we talked about throughout the week were partnerships and monitoring evaluation. Partnerships was talked about almost every single day. And I can't tell you everything that was discussed, but I will say successful partnerships were discussed, things like the USAID Global Health Fellows Program, CTPH and their work with other organizations. But the big one that we talked about were gaps in partnerships. And the biggest one is the gap in partnerships between academia and NGOs. And so there were a lot of things being said about those gaps. Why do they even exist? What are the barriers to them? And a lot of times we couldn't even identify it. We hypothesized that maybe it's because there's biases but for both NGOs for academics and academics for NGOs and how we start out our research. Maybe it's because the donors don't like to have the NGOs and the academics together. But there were a lot of things discussed, and the conclusion I think that we had is that we should just be pushing forward with some more NGO academic partnerships, either through increased training or some other kind of program that can start creating PHE degrees. Cornell, for example, I think has the very first PHE faculty appointment that they're advertising for right now. I don't think there's another school that has that. And I'm not really sure why Cornell is doing it, but it's great. I'm very proud that they are doing it. It's great. I wish I was on the market. For monitoring and evaluation, the needs here are enormous. I think it was alluded to earlier that there's a lot of indicators that are needed to monitor PHE relationships, and a lot of times the indicators that are used are not even linked well scientifically to outputs and causes, and there's a big gap there. Even Bill Gates wrote in his January or February 2013 annual letter that the Millennium Development Goals are very simple, they're very well measured, and they're great. Integration, not so much. We shouldn't go that way because he didn't say this directly, but he says, and he alludes to in his letter that integration projects like PHE probably are not effective right now for donors because you can't have measurable outcomes. And that's really important. Donors really like to see it, especially the Gates Foundation. Oh, and the other thing about donors is that some people even mention that donors don't even support M&E activities for some of the NGOs. And that's a huge problem. I know a couple of my friends at PHI have been working on a project in Guatemala for over 10 years, and they said they have maybe $50,000 over that 10-year period for monitoring evaluation because the donor was just not interested in providing those funds. So the last two things about the week were advocacy, and I put Gladys's picture up there because of what was already said. An incredible advocate. She can advocate at all levels. Talk to people in the household, farmers, giving people goats, going up to the queen and talking to her as well. How many people can talk to a farmer and a queen? I don't know very many. But you need advocates, you need champions, and these are really important. These are important for integrating PHE across sectors, increasing your probability that you can scale up different programs, and it reduces this disconnect between how communities might perceive PHE and how the organization might be perceiving PHE to implement it. And the last one is the F word, funding. There's limited funding for PHE, especially, I'm not sure, it's hard for me to compare how academics work versus NGOs, but I know in the academic world, PHE is very difficult to get support for. And we tend to have to go for more foundations and aid agencies rather than NIH or big government grants because they don't support this kind of research as much. So what are our next steps? So Tricia already said a bunch of these, so let me just say the 3 ones that I think are most important in the next 5 or 10 years. Number 1, interdisciplinary environments. This was stated by Barbara Entwistle, and I still think that it's true for the things that we have to do today. Monitoring and evaluation on all fronts has to be improved. Bill Gates said it, so Bill Pan's gonna say it. We have to strengthen partnerships. We have to strengthen partnerships. We already do that. So strengthening partnerships is kind of an innate part of PHE, but I put that down as our next step because we can't forget it. We can't forget that partnerships are probably as important as conducting any kind of work you're doing on the field or in a classroom. So we need to continue to strengthen and foster our environments. Now, I wanted to say a couple things about what we're doing in North Carolina related to PHE. One is this North Carolina One Health Collaborative. And there have been a lot of things that happened to the One Health Collaborative in the last couple months, one being that our director is now the national director of the One Health Commission. So she's actually bringing the One Health Commission for the United States down to North Carolina. And so this is going to receive a lot more visibility. So what is One Health? One Health is a group of people who are vets, MDs, public health scientists, environmental scientists, demographers, and we get together roughly once every week and we talk about a health issue, and we'll bring it up and we'll talk about it. Some of these are posted online, the recordings are online, and you can listen to them. It is a collaborative, so it's between Duke, UNC, and NC State, as well as the North Carolina State Health Department, EPA, NIEHS, and USDA. So it's quite a group of people. UNC, so even though I'm from Duke, I can talk about UNC. UNC had an IGERT program from NSF. IGERT is this integrative research training program in pop environment. It was probably the only one that's ever existed, and it actually doesn't exist anymore. The funding, I think, ended a couple years ago. But this is an ideal program to have for training people in interdisciplinary science. And before I came to Duke, I was at Johns Hopkins University, and we received an IGERT on climate, health, and water, and I was a co-PI of that. And very much the same type of training as this IGERT had. And at Duke, so I kind of feel as if, even though I work there, I'm a little bit biased, but I feel as if Duke is a trailblazer in some ways for creating interdisciplinary science. This is something that they've been doing for almost 10 years now, where they specifically have an office in the provost's office devoted toward increasing interdisciplinary research and training. And just this past year, they got a $50 million donation to transform the way interdisciplinary science and training is done. So this is the first year that this training program will start. It's called Bass Connections. And I have one of these projects that I'll tell you about. But basically the way it works for my particular project, for example, we have faculty from the School of Medicine, the School of Environment, the Engineering School, School of Public Policy, as well as Global Health. And we train students ranging from postdoc all the way down to undergrad, and they work on different projects. My particular project is in Madre Dios, Peru, and our 3 themes are really looking at livelihood diversification, where we consider these people. So this is Madre Dios down here. This is in the southern Peruvian Amazon. There's a road that cuts right through called the Interoceanic Highway, and there's a lot of gold mining that goes on. There's also, in this brown, is where there's castagna concessions, and in the green is where logging concessions are. So people are involved in a lot of different economic activities. So we're engaging Sanford School of Public Policy to do some kind of economic game theory, what are they called? Experiments in the field to figure out how people would be involved in different types of employment, weighing the environmental impact and the health impacts on themselves and their family. And then we also have a module on environmental change where we would look at gold mining and the impacts of gold mining and heavy metals, the road construction. We were recently contacted by Hunt Oil because Hunt received a land concession to begin drilling in the area. So we're going to be looking at how the impact of oil exploration might be affecting this place, as well as obviously the last theme is health. And we look at lots of things on health, but we focus on three things, which is toxicology from heavy metals, cardiovascular disease, and vector-borne diseases. And you might ask, why cardiovascular disease? And it's because it's emerging. This is a region where about 20% of the people, according to our data, are pre-hypertensive, about 30% are overweight or obese. So it's a place where people are truly impacted by both chronic and infectious diseases. All right, so last thing I just wanted to end with. This is a quote from Ehrlich and Holdren's paper again, modified to pop health and environment. So it says, to ignore population health environment today, because the problem is tough, is to commit ourselves to even gloomier prospects 20 years hence, when the most easy synergies to reduce environment and health impacts will have been exhausted. Almost word for word, this is what they wrote in their paper in 1971, and it's almost identical to what we should be saying today. We have to act now, and we have to do it now. So that's all. Thanks.
Thank you very much, Bill. So good to know that when Bill Gates says it, you will say it too. So a few reactions to some of the things that you said as we move into our discussion. I hope someone will take you up on whether Malthus is indeed the father of PHE. I think there's a lot of room for discussion and debate on that point. But I really enjoyed your presentation because I felt that we started with Gladys talking about the field and impact on the ground. And then we got a sense, Tricia talking about capacity building, and then towards the end, you brought in sort of the conceptual side of it, the research, the academic perspective. So I found that very helpful. Some of what you said also reminded me of some work that had been done by Wolfgang Lutz in a paper that he wrote, I think probably 10 years ago now, where he was deconstructing the development of PHE as an academic field, and was looking at the numbers of academic papers and research that had been conducted on PHE and that was being presented within the Population Association of America, and talked about what does it mean to have an academic field, and breaking down those components and comparing the emergence of the PHE field to these components. So some interesting overlap there with some of his work. I just last night came back from a meeting in Bangladesh where we were talking about exactly one of the points that you made about human livelihoods. And we were talking about that in the context of what is the new buzzword, resilience. And we were talking about livelihood resilience. So your comments on human livelihoods and the human livelihoods approach reminded me of these discussions that we were just having in Bangladesh about livelihoods resiliency. And this is part of the debate and the discussion moving forward. How does this concept of PHE and questions around livelihood fit in to the emerging dialogue on resilience and livelihoods resilience? So that reminded me of that also. I was intrigued by your reflections on PHE communication. As Gladys mentioned earlier, we have Ken Weiss with us in the audience, and as many of you knew, Ken has produced a great series on population and is continuing to look at these issues. So I hope that we would have some discussion about communicating around PHE and what this means. And then finally, your point on integration. And you say, well, we don't typically go to NIH to get funding for these kinds of integration. I sit on the advisory board for the National Science Foundation to really specifically advise them on integration. And they are looking at how they fund work in the area of natural sciences and ways that they can bring in the social sciences. And that advisory board has been convened specifically for them to think about integration. So I think you're right. But at the same time, I think there is emerging interest. So it's good to see some of that momentum as this field develops. So let's open up the floor for comments or discussion or questions. My colleagues will come around to you with the microphone. Because the event is being webcast live, we'll ask you to introduce yourselves and where you're coming from and to speak into the microphone. So yes, I think
Hi,
we have.
I'm Susan Newcomer, and I'm in the Population Dynamics branch of NICHD, which incidentally funds Dr. Pan, which suggests that perhaps the NIH is not an inappropriate place to come for funding. But as everybody has said, the challenges are funders' narrow-mindedness about, well, if it's population, it can't be environment. If it's environment, it can't be population. If it's health, it's neither population nor environment. And so educating all kinds of funders, not just donors, but funders who expect a product in return, like progress reports and annual reports. But to lean on the funders is an important issue, well beyond, in addition to all the other things that all of you have mentioned. I wish you strength and courage and patience with Gladys writing 8 jillion reports every week, right?
So patience, strength, and courage. All right. Yes, any questions, comments, reactions? Yes, please.
Hello, I'm Linda Bruce, and I'm the former director of the Balance Project. I have a question and a comment for each one of you. First of all, Gladys, can you tell us, when you got funding, did you get funding for both sectors at the same time? Or was it just family planning funding, which you put into your current conservation activities? Tricia, I can't agree with you more based on the experience in the Balance Project. All of your observations about partnerships are totally right on. So either we're not sitting in the same building because you're in North Carolina. But anyway, we totally, absolutely agree with you. The one question I did have for you was, or at least a comment, is that we tried to link up with the bigger health organizations in some of our activities, but their area for providing family planning did not coincide with ours. So that was a big problem. And it was a big problem, for example, in Tanzania, when in gender health would have bent over backwards to work with us, but they were not even close to our area. So that's just sort of reality in a way. And also for William Penn, I just wanted to tell you that we had an advisory board or committee for the Balance Project, and we had a couple of researchers on it. And we didn't reconvene the meeting, but I kept them up to date every 6 months and then maybe yearly. And there wasn't very much dialogue back. So I think part of that misconnect might be that people are just so busy, they don't have time to that dialogue. And maybe getting people together in the room, when we were together in the room, there was lots of going back and forth. But once you leave, it's hard for you to, I'm assuming. So I guess there's only one unanswered question for Gladys. Thank you.
Okay, thank you, Linda. That's a very important point you brought up. We started off as, it was a health project. No, wildlife health. We got funding for wildlife health work from U.S. Fish and Wildlife Service and MacArthur and WCS Food Vet Program. Then we got funding from the Irish government to do the TB work. That was separate, kind of. Then USAID thought, oh, this is really good because we're giving funding for reducing threats to biodiversity through USAID Uganda. So they gave funding to AWF to give to us. And then we started to look at TB as an entry point for looking at human and wildlife health and threats to biodiversity. Then the family planning funding came from the USAID Population Office here and added on to that. But you're right, it's been very difficult to find a funder who fund all three. But the follow-up funding we got from USAID through WCS, it was called The program was called Wild West, because it was Western Uganda. It it was reproductive health and conservation, straight conservation work. But the interesting thing is, even when it was like that, the reproductive health money came from USAID health side in Uganda. Then they gave it to WCS, who gave it to us. So we did two parts of the project. One was reproductive health, one was wildlife and livestock health, but it came from two different pots of funding within USAID Uganda. It didn't come from one pot of funding. So it is a major challenge.
And what made it integrated was that you were in the projects. All the funding went to one project side.
Yes, in Bwindi, yeah, it did. Mhm.
Yes, please.
Yeah, thank you. So yours wasn't a direct question to me, but I wanted to sort of throw a comment back at your comment, because I, was familiar obviously with the Balanced Project, and I think, the point you raise is an important one. So, I'm strongly advocating for more partnerships with family planning service delivery providers, but at the same time, I'm saying those family planning service delivery providers don't work in these areas. And so how does that work, in reality? And I think there's a couple of ways, and I'll just use the Tanzania example as one. I think that there's often these really strong technical working groups in these countries where the Ministry of Health convenes all partners working on family planning on a regular basis. And so I don't often see any sort of environment or conservation groups sitting on those teams. And I think it would be nice if they could come to the table to hear about products maybe that are coming out, like updated family planning training curriculums or upcoming trainings where maybe they could dovetail and send your staff to, or something like that. So I think it's hard if, an Engender Health or a Marie Stopes or an IPPF doesn't actually have an active project, in a area where you're working. But I think that there's still ways to leverage the sort of funding and work being done in family planning generally, again, either if it's through trainings or other things where maybe you can overlap.
Thank you. Have a question at the back?
I'm Robert Schroeder with the International Investor. We do a television program, and sorry I missed most of your presentation today, but I just wanted to let people know that there are those of us in the media. We're going to do a series of programs on related issues. We welcome any of your organizations that wants to nominate somebody for interviews. So please, I'll leave some cards back here for anybody who wants to step forward and say, we're willing to talk about these issues for television. Thanks.
Thank you. Yes, please.
Hi, Rachel Yavinsky from Population Reference Bureau. Gladys, as you know, I've talked to you many times and heard a lot about your project, but for some reason, this is the first time I've heard, it seemed like you were saying that USAID is the one who brought to you the idea of including family planning. And I'm just wondering, before that, had you been hearing anything about family planning from the community that you work with, a desire, even if they weren't saying family planning? And following off of that, Tricia and Bill, how do you think that community needs and priorities within communities which are often integrated just the way they are can drive getting donors and funders interested in PHE research and programs?
I think, Rachel, I can say that the communities never really used to talk about family planning much. It's almost something that has to come from somewhere else. Actually, before we started, we did a survey working with Mbara University and an independent company, and they had so many myths and misconceptions about family planning. They said, if you take it, you won't get pregnant again. They had so many funny stories. And then also, of course, the Catholic Church is not so strong in Uganda, so it wasn't such a big issue. But in Virunga National Park, where we've started to do this work, the Catholic Church is a bit of a barrier when it comes to family planning. So it was kind of one of those topics that was considered to be a little bit controversial. But then once it begins and the women are liberated, then they really help to push it forward.
And I'll just follow that in response to your question, which is a really good one, because I think, there's nuances to this that are really important. So when we're talking about, big blanket terms like population, some of those nuances get lost. And I think what's important in this conversation is that, we're not so much talking about, the population control of ages ago. It's about meeting an existing unmet demand for family planning that crosses, all developing countries, well, actually in developed, including ours, but especially in areas of biodiversity and the so-called hotspots. So I do think that there is this unmet demand, and if people are expressing it by saying family planning or not differs. But I think Karen Hardy has done some really interesting research with colleagues in Ethiopia when talking about climate change adaptation and issues involved in that. And, you know, they found these really fascinating qualitative responses from families that they were talking to saying, you know, our families are getting too large. We don't have enough land to split up between them. We don't have enough farm and you know, all of these issues that go along with what comes out of an unmet need for family planning. And so she was really making that connection. And I think you can see that there is an inherent natural sort of interest in and demand for it, whether or not it's explicitly said as contraception. I do think that it is about meeting this demand and not necessarily saying from an external perspective that your population size needs to reduce because we need to, you know, ensure environmental sustainability.
Can I just make one comment?
Please,
So
yeah.
just real quickly, so I think the question that you asked really depends on what you mean by community. So if you're talking about interviewing households within a community and getting the collective information about what's needed, that's one piece of information. If you're asking community leaders about what they think that the community needs, that's a separate piece of information, and it might not match. Because I know the communities that we work with in Peru, when they have turnover of their teniente gobernadores, their mayors, their needs change.
Good point. Okay. Yes, and then Jason.
Thank you. I'm Dave Rabinowitz, and I had a question for Gladys. You mentioned that when a woman comes in wanting a depot shot, she has to get her husband involved. And I'm wondering, is that still the case? How has that worked out? Because there seems to be a big difference in attitude towards birth control between husbands and wives in a lot of Africa. Do you have special training programs or something for husbands? How do you work this out?
Given that you have special powers with your husbands, have you transferred this into your work?
Well, I think from the beginning when USAID approached us, they really helped to design the program. And they said, are you going to focus on couples, you know, men or women or teenagers? And I realized that there were hardly any girl teenagers who were not married. So we weren't going to go to youth. And I also realized once these women said their husbands beat them when they're not having babies, so now you're promoting domestic violence, I said the best thing to do is to make it couple peer education. And actually that's the move that Uganda has in the family planning sector. So what we found with the program is as much as they'll talk about family planning, they also talk about other things as well. So the depot shot, for example, it's like, maybe the only resistance we've had is that some husbands that we have some men who give depot, but they fail to really become effective because the women feel uncomfortable about a man injecting them. But then other than that, the husbands know about it, and we really emphasize that they do from the beginning. When the volunteers go to the home, they have to speak both to the husband and wife. There's a lady, for example, who had 9 children, and she was on an implant and she was having side effects. And so our nurse midwife who were employed at the time was counseling her. And then I said to her, well, it's really good that, and she was beginning to take it up. She's a community leader. And I said to her, why don't you just have a tubal ligation because you've had 9 children? Do you really want to have more? Then she said, my husband won't allow it. He'll allow me to have the implant, but not the tubal ligation. And so I said, are you willing to go on radio to talk about it? She said, yes. So she went on radio with her husband, and the volunteer. And then after that program, we had so many people, you know, wanting to get onto family planning.
Jason?
Thanks. I'm Jason Bremner from Population Reference Bureau. I just wanted to reaffirm Tricia's point on the unexpressed desire for means of addressing family size, and that is, we were successful in Kenya in getting a question on the Demographic Health Survey back in 2008, 2009 that actually asked at the household level across all the countries, actually only asked those people who owned land, whether or not they felt like their land was sufficient to provide for their family. And the majority of respondents said no. And then the second was we asked people a separate question, whether or not they felt like there was sufficient land in the community for their children to stay and stay in the community and farm there. And the majority, a greater percentage, said no. So certainly in Ethiopia and in Kenya, and we've looked at this at different provinces, the land issue and land availability is a real issue that is recognized, and that may not translate into a desire to use family planning, but a perception of family size issues and land availability is often there. And you can talk to lots of people at high levels down to the community, and they get that. The question that I had is for Bill, and you mentioned a gap between academics and these projects and the monitoring and evaluation. And I guess I posed to you, how might we address that gap? My own experience with that is that the monitoring and evaluation needs of projects doesn't equate to good research projects for academics. And might be great for master's students, and we actually have some good experience with master's students. Might be good for a researcher or an academic at a local university in that country whose number one product might not be a paper. But what do we do for you where the data sets that come out of these projects aren't going to match your kind of needs for research?
So Duke is actually, we have two big committees that are addressing that exact question. And one of the things that we're thinking of developing is called an evidence lab, where we have programs doing monitor and evaluation. And it would be kind of like a separate entity to Duke, but it would be working on trying to scale up and doing monitoring and evaluation of programs for health technology, engineering, new engineering technology. It could be some kind of environmental technology from the Nicholas School. But the idea is to really see what it would take, what would involve doing that type of research, and what structures, what type of people that you actually would need to be housed in an evidence lab. So we are working on that. And it actually is a collaborative effort with the School of Business, who are trying to construct a business model for it, as well as Global Health and Environment and SSRI, which is the Social Science Research Institute at Duke. So we are trying to pull all that together to see how we could do that. But those meetings have only just started this past summer, so we don't have any progress on it now.
Yes.
I'm Sally Lam, Ecology and Environment. I've been involved in wildlife environmental conservation and associated human dimensions since 1980 in Central Africa, and did some work in Democratic Republic of Congo. I'm familiar with World Wildlife Fund's PHE program there in Salongo National Park and all the challenges that they've encountered as well. And I was fortunate to be involved in some One Health training with the Ministries of Public Health, Agriculture, and Environment in that country as well. Since last June, I've been working in your country, Dr. Gladys, looking at investigating the impacts of the petroleum exploration in the Albertine Rift Valley. And in light of that, first of all, I wanted to know if, I know you have gorillas are your charismatic species that you're focusing on, and of course everything benefits in the ecosystem of the park. But I was wondering if perhaps you would be expanding your activities and maybe perhaps focusing on other charismatic species in your country, like for example lions, of which there are, you know better than I, there are fewer than 500 left in your country, with its two strongholds in Murchison Falls and Queen Elizabeth National Park. If you had any plans to expand your activities to include those areas and perhaps that species, and do you have any vision for expansion of your activities in light of the accelerating petroleum activities, going beyond exploration now into actual development, which brings pipelines, roads, refineries, and a lot of people into the whole Albertine Rift Valley.
Yep. Yeah, that's great that you've worked in that part of the world. And yes, WWF, I guess, is a leader in PHE, and Andrea is here. They supported me as an Education for Nature Fellow. Regarding, as we said, when we started the CTPH, the logo, as you can see on my shirt, it was like the number 10 version, and everyone's like, why do you just have gorillas there? And then, why are the gorillas above the people? And there were so many things, and which you're addressing all the time. But then I said, WWF has the panda, but they're addressing everything. So the gorilla is the charismatic species, but it attracts people to what you're trying to address. And yes, we have actually started doing work in Queen Elizabeth, again with support from USAID and MacArthur Foundation. And we basically looked at, because our focus was disease and the human wildlife livestock interface, that situation is pastoralist grazing in the national park. And it's a major conservation issue. Plus a bit of poaching, but the main thing is the pastoralists wanting to graze in the park and get it degazetted. So we look at the disease issues between the buffalo, which are closely related to the cattle, and the goats and the Uganda cob, and then also the people who can get brucellosis from their cows, which could have grazed with wildlife if it's coming from wildlife, or tuberculosis and other things like that. And interesting enough is that the fishing villages around Queen Elizabeth National Park, it's a very interesting park. It's actually considered a man and biosphere reserve, because from the very beginning, they've always allowed people to stay in fishing villages around the park, partly in the park enclaves. The numbers have increased 5 times. Like there used to be like 30,000 people, now it's gone up to huge numbers in the past 10 to 15 years. So there is a great need for the PHE approach in those areas. And it's difficult to get family planning money, maybe because we're not in the family planning arena, but even the way it comes into the country, they say, we're doing district A, B, C. And the district, if it's not bordering the national park, they're not interested. But we do definitely want to start, involving scaling up the PHE model. Normally for us, it started off with health, then the family planning comes later. The health and environment issue and family planning comes later. Typically, it's been like that, even in Virunga. Mount Elgon is another area where I've mentioned we also really want to go to. Now, regarding the oil, it is very depressing. And actually, these very pastoralists like to poison lions, which go and eat their cows. So we're training them. We have a similar group of community animal health workers and community health workers, like in Bwindi, and they're really educating their community to value the wildlife, not to poison the lions. They recently rescued a baby elephant, which was drowning, which they wouldn't have done if we hadn't trained them and told them to trust the Wildlife Authority, who they really hate with a passion, but the hate is reducing because in 1950, when it was created as a park, they chased them away. It was fences and fines. But now the relationship is improving, and the baby elephant's now at the zoo. So we're trying to get them more and more involved in that kind of thing. Now, regarding the oil and gas issue, it's really an emerging thing in Uganda. It's a big threat to conservation. They have much more power than the Wildlife Authority. The Minister of Energy has a lot more say and power than the Minister of Tourism and Wildlife. And so when they decide that they want to do something, they just do it. So at Wildlife Authority, because I'm now sitting on the board, it's one of the major issues we have to address, approve the oil guidelines and things like that. We're trying to reduce the damage, which is already started. For example, a lion drank some oil, ingested some oil and died. And we're like, so how much should the company pay? The company hasn't even paid anything yet, and there's gonna be many more situations like that. And they're very happy to drill, but they're not happy to restore. So it's an area that Wildlife Authority needs a lot of capacity in. I don't know how CTPH, as an NGO, if the PHE approach can help in that situation, but it's something that would be interesting to look at. When they start the seismic drilling, which is just beginning, everyone fears that the elephants will leave the park because they'll hear the vibrations and cause even more human-wildlife conflict, which is already quite great in the communities around Murchison. So it's a very interesting area that needs to be tackled.
Well, thank you very much. let's thank our panelists. I think we had a very good and rich discussion today, so thank you.
Thank you to all for coming.
So as we normally do, we'll have a short write-up of the discussion today, and we'll invite you to visit our website at wilsoncenter.org and our blog newsecuritybeat.org for continuing updates on the program. Thank you very much.
Thanks.
Thanks.
That was great.
Me too. Good.
That was great.
He just said, and then he left.
Yeah. Trisha?
Great. Thank you. That was really
Trisha,
good.
Jason's going to take our picture here.
yes.
And Roger.
Sorry.
Roger, the discussant.
Good?
Cool.
Thank you so much for inviting me. This is